what do we have here? Well, I think you will agree that it is a nice x-ray of the knee area. You could recognize this as the distal femur, and you could identify this as the proximal tibia with your medial and lateral tibial plateaus. But another thing that you can realize is the fact that there is destruction of this bone in a very irregular fashion. In addition, there appears to be some spicules or denser area growing out of the cortex, almost like little spikes. Why might that be? Well, here's a gross picture of the tumor. You can see the distal femur again. You could see that within the distal or perhaps mid-distal portion of this bone, there is irregular tissue that is destroying the cortical bone, extending into the surrounding soft tissues, and is pushing its way distally as well. This is a classical appearance of an osteogenic sarcoma. Osteogenic sarcomas are also called osteosarcomas less commonly, and they occur usually in teenagers in the knee region, perhaps the distal femur or even the proximal tibia. There is another age incidence for osteosarcoma, which occurs in later life in the elderly, very frequently in the setting of previously existing Paget's disease. Here's another osteogenic sarcoma in which you could see that the tumor has relatively spared the cortical bone over here and over here, but now has completely invaded it, the marrow, the cortical bone, and even is pushing its way through the epiphyseal plate as well, and you could see that it is completely broken through here, and it looks like it's even coming towards the articular cartilage. And I guess if you waited long enough, it'd probably even grow through the person's knee pads as well. Let's take a look at this microscopically as now. Notice that in some areas of this you might get the feeling, in this thicker, more cortical looking bone, that the bone doesn't look too bad. It looks pretty well organized. However, as you get into the more cellular areas, you don't have those nice cortical areas anymore, or even spicules. Notice there appears to be rather primitive looking spicules, or perhaps even more like osteoid. This is a classical appearance of a osteosarcoma, more commonly called osteogenic sarcoma, in which you have very small but primitive looking tumor cells, perhaps an osteoclast over there, which are not only destroying but perhaps producing a new type of abnormal bone. Osteogenic sarcomas are truly malignancies of bone tissue for this reason. Like any other sarcoma, which usually goes to the blood vessels first rather than the lymph nodes, when you see a chest x-ray of somebody that has densities within their lungs that look like balls, but they're so dense they almost have the density of bone, it might be because they are bone, or actually they're primitive bone or osteoid produced by these osteogenic sarcomas, which, like any other sarcoma, metastasizes usually quickly to the lungs. And very often the person's first presenting symptoms might be a cough, shortness of breath, pulmonary symptoms. Maybe they think it's a cold. Maybe they go to the emergency room a few weeks later when they can't shake it, and they might have an x-ray that looks like this. Thank you very much.